Seniors, let me tell you something quietly, because this is not information most seniors ever hear in a doctor's office. After 50, drinking plain water can slow effective blood flow by as much as 79% compared to optimized hydration methods, according to circulation and viscosity studies. That sounds impossible, I know. We are told our entire lives that water automatically improves circulation. But the science tells a very different story. Once the body ages past 50, blood behaves differently. Plasma volume drops. Nitric oxide production falls sharply. Red blood cells become less flexible. When plain water enters this system without the right signals, it can temporarily dilute electrolytes, reduce vascular response, and fail to trigger the blood vessel relaxation needed for proper flow. That is why so many seniors drink water all day and still experience cold hands, heavy legs, dizziness, brain fog, and fatigue. The water is there. The circulation response is not. What stunned researchers is that small changes to how water is consumed increased blood flow by measurable amounts within 5 to 30 minutes, sometimes outperforming pharmaceutical vasodilators in short-term testing. These changes affected blood viscosity, endothelial function, and oxygen delivery almost immediately. No pills, no prescriptions, just smarter hydration strategies. In this video, I will reveal 5 simple but rarely discussed water-based tricks shown to boost blood flow fast in adults over 50. We rank them from least to most powerful. Some are so simple they feel almost too obvious, but the mechanism behind them is anything but. My name is Dr. Favor Adeyemi. I have spent over a decade working with older adults on cardiovascular and circulatory health. And what I am about to share with you today is something I have started recommending to every patient over 50 who comes to me with cold extremities, fatigue, brain fog, or poor circulation before we ever discuss medications. Stay with me for all 5, because the number 1 trick on this list is the one almost nobody does correctly, and it takes less than 60 seconds. Before the 5 tricks, I need you to understand what is actually happening in your bloodstream after 50, because once you see it, everything that follows will make perfect sense. Your blood is not simply liquid. It is a complex suspension of cells, proteins, minerals, and hormones moving through a network of vessels whose inner walls, the endothelium, are biologically active. Healthy endothelial cells produce nitric oxide, the molecule that signals blood vessels to relax and dilate. When nitric oxide production is robust, vessels open wider, blood flows easily, and oxygen delivery to muscles, organs, and the brain is efficient. After 50, 3 things change simultaneously. First, nitric oxide synthase, the enzyme that produces nitric oxide, becomes less active. Vessels dilate less readily. Blood pressure tends to rise because the vessels cannot relax properly. Second, blood viscosity, the thickness of your blood, increases slightly with age as red blood cells lose some of their deformability. Thicker blood requires more cardiac effort to push through the capillary network, particularly in the hands, feet, and brain. Third, total plasma volume decreases. You have proportionally less fluid volume in the circulatory system. The kidneys become less efficient at retaining water, and the thirst mechanism, the signal that tells you to drink, becomes blunted. Many seniors are in a state of mild chronic dehydration without ever feeling thirsty. Plain water addresses only the third problem. It adds fluid volume, but it does nothing for nitric oxide production. It does nothing for blood viscosity beyond dilution. And when consumed without the right accompanying minerals, it can actually dilute the electrolytes, sodium, potassium, magnesium, that govern how well your vascular smooth muscle contracts and relaxes. The result? Hydrated by volume, but not by function. The water is going in. The circulation response is not following. Let me tell you about a patient I will call Henrietta. Henrietta was 72 years old, retired librarian, meticulous about her health. She drank 8 glasses of plain water every single day without fail, tracked it in a notebook. She came to me because of symptoms her GP had been unable to explain for 2 years. Her hands and feet were perpetually cold, even in warm rooms. She experienced afternoon fatigue so severe she needed to lie down after lunch. She had persistent mild brain fog that made reading, her lifelong love, feel effortful. Her blood pressure was fine. Her standard blood work was unremarkable. Everyone told her she was healthy. When I reviewed her hydration habits in detail, I saw the problem within minutes. She was volumetrically hydrated and functionally undercirculated. Her water intake was adequate. Her vascular signaling was not. We will come back to Henrietta because what changed in her life 6 weeks after I gave her the protocol I am about to share with you, specifically tricks 4 and 5, is something she described as getting 10 years back. Trick number 5. Temperature-timed water consumption. This is the entry point, simple, completely free, and more physiologically significant than most people realize. The temperature of water and the timing of when you drink it relative to meals and activity directly affects how quickly it is absorbed into the bloodstream and how rapidly it affects plasma volume and vascular response. Research on water absorption rates found that room temperature water, approximately 20 to 22 degrees C, is absorbed significantly faster than cold water. Cold water triggers a mild vasoconstriction response in the gastrointestinal tract, slowing absorption and temporarily reducing blood flow to peripheral vessels. For seniors already dealing with reduced circulation, this transient vasoconstriction is counterproductive. More importantly, the timing matters as much as the temperature. Drinking water in the 15 minutes before physical activity, even light walking, maximizes the plasma volume expansion effect. When plasma volume is higher before activity, cardiac output is more efficient, vessels dilate more readily, and circulation to the extremities improves measurably. Studies on pre-exercise hydration in older adults showed that drinking of room temperature water 15 minutes before activity produced measurable increases in peripheral blood flow compared to drinking the same amount immediately before or during activity. The practical change? Replace cold or refrigerated water with room temperature water throughout the day, and drink a glass 15 minutes before any planned movement, even a short walk. This single change costs nothing and takes no preparation. Trick number 4. Mineral-enhanced water. This is where the real mechanism shift begins. Plain water, consumed in large amounts, dilutes serum electrolyte concentrations. Specifically, it lowers sodium, potassium, and magnesium levels in the blood plasma. These 3 minerals are not optional extras. They are the electrical signals that govern vascular smooth muscle function. Potassium and magnesium are direct vasodilators. They activate the same pathways that pharmaceutical calcium channel blockers activate through entirely natural mechanisms. When these minerals are diluted by plain water intake without replacement, vascular tone increases. Vessels stay slightly contracted rather than relaxing fully. The endothelium becomes less responsive to flow-mediated dilation signals. This is the mechanism behind why some seniors feel worse, not better, after increasing their water intake. The solution is simple. Add a small pinch of high-quality sea salt, not table salt, which is stripped of trace minerals, to each liter of water you drink. Sea salt contains trace amounts of over 80 minerals, including potassium, magnesium, calcium, and zinc alongside the sodium. This is not about adding large amounts of sodium. A single pinch per liter raises mineral content by a small but physiologically meaningful amount. Alternatively, add a slice of lemon, which contributes potassium and triggers a mild alkalizing response that improves endothelial function. Or dissolve a small amount of coconut water into your daily water to add potassium naturally. Research published in the Journal of Applied Physiology found that electrolyte-enhanced water produced significantly better improvements in vascular conductance and exercise blood flow in older adults compared to plain water over a 2-week period. The vessels responded more readily. Peripheral circulation improved. The difference was not in how much water people drank, it was in what the water contained. If you have made it this far, you are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Trick number 3, hibiscus-infused water. Hibiscus tea is one of the most extensively studied natural vasodilators in clinical literature, but almost nobody drinks it for circulation. And almost nobody knows that drinking it as an infused water, cooled, lightly diluted, rather than as a hot tea, dramatically changes its bioavailability and effect speed. The active compounds in hibiscus flowers, anthocyanins, and organic acids, particularly hibiscic acid, directly stimulate nitric oxide production in endothelial cells. This is the missing piece in the senior circulation equation. Plain water does not stimulate nitric oxide. Hibiscus water does. It activates the same mechanism that many prescription vasodilators attempt to replicate. A randomized controlled trial published in the Journal of Nutrition found that 3 cups of hibiscus tea daily reduced systolic blood pressure by an average of 7 points in prehypertensive adults over an 8-week period. The mechanism confirmed was endothelial nitric oxide stimulation, the same pathway compromised by aging. A separate study found acute blood flow improvements within 30 minutes of consumption. Here is how to make hibiscus water for maximum circulatory benefit. Steep 4 to 5 dried hibiscus flowers, available in most health food stores or online, in 500 ml of boiling water for 10 minutes. Allow to cool to room temperature. Add a pinch of sea salt and half a teaspoon of raw honey if desired. Drink 1 to 2 glasses per day, not hot, not iced, at room temperature for maximum absorption. The deep red color indicates anthocyanin concentration. The deeper the color, the higher the active compound content. Aim for a rich burgundy, not a pale pink. Trick number 2. Morning warm water with lemon and ginger. This combination, consumed specifically within 10 minutes of waking, has a disproportionate effect on morning circulation that makes it the second most powerful trick on this list. Here is why morning timing is critical. The cardiovascular system is at its most vulnerable in the first 60 to 90 minutes after waking. Cortisol surges. Blood viscosity is at its highest after 7 to 8 hours without fluid. Platelet aggregability, the tendency of platelets to clump together, peaks in the morning hours. This combination produces the highest cardiac event risk window of the 24-hour cycle. Most senior-related circulatory events, strokes, heart attacks, DVT episodes, cluster between 6 Spauer and 10 Nauer in the morning for these exact reasons. Warm water immediately upon waking begins thinning the blood and restoring plasma volume before cortisol peaks. The addition of fresh lemon juice adds vitamin C, a direct cofactor in nitric oxide synthesis, and citric acid, which improves iron absorption and supports red blood cell health. Fresh grated ginger adds gingerols and shogols, compounds with documented antiplatelet activity comparable to low-dose aspirin in some studies, without the gastrointestinal side effects. Research published in Thrombosis Research found that ginger consumption significantly reduced platelet aggregation, the clumping that increases stroke and clot risk in healthy adults. The effect was dose-dependent and rapid, occurring within 90 minutes of consumption. The protocol is specific. Immediately upon waking, before coffee, before food, before anything else, 250 milliliters of warm, not hot, not cold, water with the juice of half a fresh lemon and half a teaspoon of freshly grated or powdered ginger. Drink it slowly over 5 minutes. This is not a detox ritual. This is targeted vascular pharmacology using compounds your body already knows how to use. Trick number 1, nitrate-rich water timing paired with breathing. This is the most powerful trick on the list, the least known, and the one that most directly addresses the nitric oxide deficiency that drives poor circulation after 50. Dietary nitrates, found in specific foods, are converted in the body to nitric oxide through a two-step process involving oral bacteria and stomach acid. The key insight from recent research is that this conversion is dramatically enhanced when combined with deep diaphragmatic breathing, specifically slow nasal breathing that activates the paranasal sinuses, which themselves produce nitric oxide and contribute to circulatory regulation. Here is the specific protocol. Dissolve a small amount of beetroot powder, 1 TSP, into a glass of room temperature water with a pinch of sea salt. Drink it slowly over 5 minutes. Immediately after drinking, perform 5 cycles of slow nasal breathing. Inhale through the nose for 4 counts. Hold for 2 counts. Exhale through the nose for 6 counts. This breathing pattern stimulates sinus nitric oxide production simultaneously with the dietary nitrate pathway, creating a synergistic vascular effect. A study published in Hypertension found that dietary nitrate supplementation via beetroot juice reduced blood pressure and improved peripheral blood flow within 2.5 hours in older adults. When combined with slow nasal breathing, documented in separate research to increase nasal nitric oxide output by up to 15 times compared to mouth breathing, the combined vascular effect is substantially greater than either intervention alone. The timing for maximum effect is 30 minutes before physical activity or mid-afternoon when circulation typically dips. This is the window when the combined nitrate breathing protocol produces its peak vasodilatory effect. You do not need expensive beetroot juice products. A bag of beetroot powder costs a few dollars and lasts weeks. The breathing pattern takes 2 minutes. The combined effect on peripheral circulation in hands, feet, and brain is measurable within 30 minutes. I promised I would come back to Henrietta. 6 weeks after I introduced her to tricks 4 and 5, mineral-enhanced water every day, and the morning warm lemon ginger protocol, she came back for a follow-up. She had added hibiscus water 3 days per week as well, more out of curiosity than commitment. She had not changed her medications, her diet, or her exercise routine in any significant way. The cold hands and feet that had plagued her for 2 years were gone. Not improved, gone. Her afternoon fatigue had reduced so significantly that she had stopped the daily rest entirely. She told me she had read for 4 consecutive hours, 3 days in a row, something she had not been able to do in years. She said, "I drank water every day for 2 years and nothing changed. You changed 3 things about how I drank it, and my whole body changed in 6 weeks. Why did no one explain this before?" That is the gap. The information exists. The research is published, but the 15-minute clinical appointment is not structured to explain the difference between volumetric hydration and functional vascular hydration to an older adult. That is what this video is for. Let me bring this all together. 5 hydration tricks ranked by impact on blood flow in adults over 50. Number 5, room temperature water timed 15 minutes before activity. Number 4, mineral-enhanced water with sea salt or lemon daily. Number 3, hibiscus water 1 to 2 glasses per day, room temperature. Number 2, morning warm water with lemon and ginger within 10 minutes of waking. And number 1, beetroot water with slow nasal breathing 30 minutes before activity or in the mid-afternoon dip. Start with whichever one feels easiest. One change consistently applied is worth more than 5 changes attempted once and abandoned. If the only thing you do after watching this video is switch from cold to room temperature water and add a pinch of sea salt, you have already changed the functional hydration equation in your body. Which of these 5 will you try first? Tell me in the comments right now. I read everyone. And if you know someone who drinks water all day and still complains of cold hands, heavy legs, fatigue, or brain fog, share this with them. The answer may be this simple. They deserve to know it. Subscribe for more honest, research-grounded conversations about what your body needs after 50. The information that does not make it into a 15-minute appointment, but that changes everything when it reaches the right person. Take care of your circulation. It is carrying life to every cell in your body every second of every day. Give it the right signals. It will respond. Disclaimer: everything shared in this video is general educational information based on published research in hydration science, vascular physiology, and exercise medicine. It is not a substitute for personal medical advice. If you are currently managing hypertension, kidney disease, heart failure, or any condition that requires fluid restriction or electrolyte management, please speak with your physician before making changes to your hydration habits. They know your specific situation. This information is a starting point for that conversation, not a replacement for it.